here comes the news lead. And you're up.
Good afternoon. I'm Mike Harris with the Any County Public Health Department. Today we have had 2 reported cases of an infectious disease at a local hospital. The hospital has taken necessary isolation precautions pending the results of lab work and a confirmation of diagnosis. We have no indication that this will become widespread. In the meantime, we ask that you remain vigilant. If you or anyone you know exhibits the following symptoms, please contact your physician or a local emergency department before going to a medical facility. These symptoms include sore throat, vomiting, fever, diarrhea, joint and muscle aches, and weakness. The individuals in question have returned from a trip to Central Africa, and we are monitoring the situation closely. We will hold a press conference when more information becomes available. If you have any questions, please contact Jane Smith at Any County Public Health Department at 530-564-9287 or email jsmith@acphd.org. You can contact her Monday through Friday, 8 a.m. through 5 p.m. Are there any questions?
Mr. Harris, I'm BJ Boyd at WNTF News. We've heard that the hospital, Elsewhere Community Hospital, is on voluntary lockdown and that nobody's allowed in. Can you confirm whether or not you've asked the Elsewhere Community Hospital ED to close?
At this time, they are currently on voluntary isolation and are controlling access to the hospital. They are continuing to treat patients. We just had that. They are just allowing themselves to make sure that anything coming in or out is contained, and that if there is an infectious disease, that it does not get out to the general public.
So you really think you have a contagious agent or virus and you're trying to contain it before it gets a lot worse, is that correct?
At this point, we cannot confirm anything, but we are just taking necessary precautions so that if it is, it does not get out and that the public remains safe.
Mr. Harris, I'm Dana Summers, your local Action News reporter. I understand through a HON alert issued just recently that a hemorrhagic fever has killed 16 people and infected more than 50 others in Uganda. It's been confirmed as the deadly Ebola virus. The casualties are all in the region of Bundibugyo on the border with the Democratic Republic of Congo. Now, the Democratic Republic of Congo has been battling for 5 months to contain this Ebola virus outbreak that's close to its border with Angola. If these individuals from the U.S. were working in the same area, isn't it possible that this is the same type of hemorrhagic fever known as the Ebola virus?
Again, we cannot confirm that this is a hemorrhagic fever, but the hospital is taking precautions to keep any whatever it may be from getting out.
Mr. Harris, what about the people who choose not to stay at the hospital but they leave and go home? Are they being monitored or tracked regarding their activities and especially contact with other people?
We ask them that they please stay in contact with the public health department so that they may monitor the situation.
Don't you really think that this isolation or quarantine should have been made mandatory?
We cannot confirm or deny that it is a hemorrhagic fever. So we're just taking the basic steps to keep whatever it may be. It may just be something in the water or a bad pizza from getting out. So when in doubt, get checked out. Thank you.
Good job. Good job.